bear with me 1 second. So yeah, thank you for everyone for joining. A warm welcome to everyone. Those of you who've never heard of our organisation and don't know who we are, just want to give a really quick introduction to our charity, and then I'll hand it over to Dr. Saleem, who can start the programme. So my name is Rubina, and I work across various different roles, and I wear a few different hats for the charity. And I'm here with our chairman, Dr. Saleem Khan, today to bring you our first online health awareness programme. We usually conduct these in person, but due to COVID-19 and large gatherings being banned, we decided to bring you a virtual programme today. So yeah, we're from International Foundation for Mother and Child Health, or IFMCH for short, and we're a small charity working in the UK and Pakistan to improve the health and lives of women and children. And we're trying to achieve this through 3 pillars. So we're increasing access to free and best practice healthcare in the most vulnerable areas of the world. And we're doing this through establishing free healthcare centres. So Pakistan has the world's highest neonatal and maternal mortality rates. And within Pakistan, Sindh region has the highest death rate. So in 2013, we opened a free clinic in a rural village called Menopause, and it's seen almost 17,000 patients till this day. Before we opened, the village had no free healthcare facility within a 50-kilometre radius and no pharmacy. So for the past few years, we've also been working really hard to construct the first maternity hospital there. Our second pillar is training. So we conduct trainings for healthcare professionals in Pakistan to improve the standards of care. So we train people in formal healthcare settings, such as midwives in hospitals, community health workers, and also informal healthcare providers, such.
Rubina, can you mute all the participants because there is background noise? Rubina?
Women in rural villages at the top of a mountain, which I've been very lucky to take part in and witness. And finally, our third pillar is educating and empowering women to look after their health, which is what we're doing today with you guys. So we conduct health awareness programs with women in the UK. These are free of cost, and we also offer a variety of resources for women free of cost too. So we have an ongoing series called Women's Wednesday, where you can ask us any women's health related question and we answer it for you anonymously. So you can just message us on Facebook or website or email. And we also do video blogs covering different health topics. And last month we started a new series on Facebook Live called Health Series, where we're offering holistic mind, body and soul solutions for common health problems. So we've done a talk on depression, happiness, and last week we talked about obesity. So everything we offer is free of cost, and all our services depend on the support of people like yourself. So when the program is over, we would love for you to give us a follow on our social media platforms. So yeah, thank you so much again for taking precious time out of your Sunday to join us, and it's really fantastic to see. So without further ado, I'll hand it over to Dr. Saleem, who will start the program for us.
Okay, thank you, Rubina. Thank you very much for the intro. Just briefly, my name is Dr. Saleem Khan, and I'm the chairperson of IFMCH. I also work as a consultant in Obstetrician and Gynaecologist in Carlisle, in Northumbria Hospital Trust, and I have various other things which I do, but the main passion is to improve awareness among women so that they can look after themselves, and if they can look after themselves, they will in turn look after their families, and so on and so forth. So the health awareness program is very basic. All the things are evidence-based, and feel free to send us any questions while we are going through the program, and Rubina will in turn ask me the questions, and I'll be more than happy to answer them. So we'll start with the awareness program now. The whole idea of the awareness program is to make you all aware of what are the things which are important There is a very famous philosopher called Henry Bergson. He says that our eyes can only see those things which our brain knows. You see? So, for instance, I'm talking to young females, and if you see a Chanel bag, you will be able to identify from a distance the Chanel logo. But if I pass something else, like a cricketing tool or any sport other than fancy sport, you won't be able to recognize that because your mind is geared towards that particular thing. So all the designer brands you will be able to identify only because your brain all knows about it, and then your eyes can pick it up, and then so this is what awareness is all about. And I hope that today's program will enable you to see things slightly differently and be more conscious of what to do and what not to do. There's another philosopher called Thomas Fuller. He suggested that knowledge is a treasure, but if you don't practice it, then it's no point. The key to knowledge is to practice and spread and empower others. So these are the two basic principles of our awareness programs. And today we'll cater about prenatal care, basically. Prenatal care means, pre means before, natal means pregnancy, care you all know. So prenatal care means care before pregnancy. So very, very important for those young women who are planning for a pregnancy or they're planning their marriage or wedding, etc. Then it is very, very important for you to make sure that your body is in perfect shape before you get pregnant. Because the healthier the body, then healthier the pregnancy will be. Yes? So it's very simple. So if you are at the peak of your health, then if you get pregnant, you will have a nice healthy pregnancy. But before pregnancy, there are a few things which we have to be very much aware of. For example, a thing called rubella. Rubella is German measles. And here in UK, who have been born and brought up, most likely you would have had the MMR vaccine when you were at your childhood. But those who have come from abroad, maybe they may have missed this vaccination. So even if you're thinking of planning your pregnancy, please do visit your GPs and ask them to check whether you are rubella immune or not. It means that whether you have the vaccination early on or not. Because if you conceive and you are not immune, then there is a chance that you may get rubella. And the problem with rubella is that if you are infected with rubella, it affects every part of the body of the baby. And it is known as fetal rubella syndrome. It starts from the top, from the head to the toes. So in the brain, it causes small brain, is called microcephaly. Eyes, they can cause multiple eye problems, cataracts. Bones, they can cause developmental delay. They can cause deafness. They can cause diabetes. They can cause pancreatic problems. So just a simple thing, vaccination can prevent all these things. So if you are infected, what happens that either you may have the disease and you may miscarry. If you miscarried, yes, it's bad, but it's not too bad because you can try again. But if the baby gets infected, then it's a lifelong problem for that child. Lifelong problem. Okay, and it affects your family life, it affects the life of the siblings. So it affects everyone. And it's a very easy way to prevent that is by getting yourself vaccinated. By going to the GP, asking them to check whether you are immune or not. If you are not immune, then please get the vaccination. The vaccination is a live vaccine, so it is imperative that you take precaution like contraception for at least 3 months because it's a live vaccine and it can infect the baby if you conceive during that period. So it is imperative that you make sure that the 3 months you don't get pregnant. So simple thing, rubella, check whether you are immune or not. If you're not immune, then get rubella vaccination, because if you get rubella and you're pregnant, it can affect the baby. Either you can miscarry, or if the baby is infected, it can affect the baby in the fetus in all the systems of the body, and then it's a lifelong struggle, a lifelong problem. So please think about it and talk among your friends as well. It's not about you, talk about your friends as well, because if they're planning a pregnancy, oh, have you checked your rubella? It's simple thing, have you checked your rubella? And if not, get it checked. Okay, so it's simple. The first thing is rubella. Second thing, unfortunately, still I'm very, very surprised and quite depressed that girls living in UK, young girls, they still suffer from anemia. There is no excuse for you all to suffer from anemia, because we have best of food available in our country. Okay, so there is no excuse to be anemic. Most of our Asian population suffers from anemia. Why? Because we don't eat healthy food. Our food is more for nutrient value. We'll cook and cook and cook and make sure that every nutrient is dead. Then we will eat the food, which is not right. Yeah. And you all must have heard 5 a day. Yes. I hope so that you all know about 5 a day. But if I ask you how many have 5 a day, 5 portions of fruit, veg in a day, how many of you have that? Maybe 10-20%. So it is very, very sad that living in a country where we have best of food and we are not deprived as such. And so why can't we have 5 a day? Like girls who are working, I've seen a number of girls going and getting a Costa coffee or a coffee Cafe Nero or Tim Horton. One coffee costs about 350. Yes, and for £350 you can have a week supply of some fruit like grapes or bananas or apple or XYZ. So it is our duty to make sure that we maintain our health. Yeah, it is not the duty of anyone else, not the duty of our parents, but you have to maintain your health. No one else will. So I'm sure that most of the girls, Asian girls, they don't know what is their iron level. I know someone very close to me, and she was anemic, and he kept telling her that, look, it seems like you're anemic, and she did not used to listen to me. And eventually she checked, and she was anemic, and she changed her lifestyle, and she changed her diet a bit.
Thank you, Dr.
And
Saleem,
now,
referring to me, everyone. I was a vegetarian for a few years and ate lots of healthy things, but I was still anemic, and Dr. Saleem kept on telling me. And I implemented what he said, and now I'm perfectly fine. So
yeah, so it's not nice, no, that my own secretary, who I treat like my own kid, suffers from anemia, and I'm going around the world talking about anemia. So what is anemia? Anemia is the definition of anemia is, according to WHO, is different countries have different set values. It's 110 grams per liter of hemoglobin, or if you go to Pakistan, it's 11 deciliters per liter. So it all depends where you go, but it's, if you make up your mind, it's 11 or 110 to 140. That's the normal level, and you can get it checked anywhere, at your GPs, at your pharmacies. In Pakistan, a few of the pharmacies are trying to do that as well. So check and see whether you are anemic or not. Because it's a simple thing. Look, my awareness program is no rocket science. It's very simple, because I don't believe in introducing fancy stuff. It's very basic. If your iron count is low, what does iron count does? What does hemoglobin do in the body? It picks up oxygen and supplies to the whole brain, whole body. And what oxygen do the to the body is that it is the source to bring energy, and it makes the body work. It's an engine. It's like a fuel for the body. Yes. And naturally, you must be hearing that a lot of people say, "Oh, I'm very tired. I feel tired." The reason you feel tired is because there is not enough oxygen in your body, because there isn't enough hemoglobin in your body to pick up those oxygen and take it to the different part of the body so that body works. So it's simple. It's quite simple thing. So anemia means lack of hemoglobin. Lack of hemoglobin means lack of oxygen. Lack of oxygen means that your body is not having enough body fuel, because oxygen supplies to the different part of the body and it burns, and this is an engine, fuel for the body. So hence anemia is very, very, very important to correct. Okay, so it is, again, and you can well imagine that if you're already anemic and you conceive, the baby gets pregnant, and the woman gets pregnant, and the fetus needs much more energy supply and iron supplements and so on and so forth. So if you're already depleted, what will happen? Will you have a nice healthy baby, or the baby will be suffering, or baby may compromise? Common sense. If you're not healthy, if you don't have enough supplies, the baby will suffer as well. Yes, it is very, very important. So unfortunately, you see in the next slide, it's 52% in the developing world like India, Pakistan, Bangladesh, Sri Lanka, with the women suffers from anemia. In the developed world, 23% suffers from anemia. Of the 23%, most of them are from ethnic minority. Why? Because though we live in a European country, but we still carry on our bad habits, the food habits. It has to be, the oil should be on top of all our curries. The curries should be cooked and cooked and cooked, that we destroy everything. No, for heaven's sake, it's about time that we start changing our lifestyle. It's about time that we think what we are doing with our lives. Yes? You can well imagine a 50-year-old Caucasian woman and a 50-year-old Asian woman. You can see the difference, what I'm talking about. Yes? And it is all down to their dietary habits, their lifestyle, how they live. Okay? So it is imperative that if you are planning to conceive, you should know your blood level as well. So first was the rubella, whether you're immune or not. The second thing is your blood level, whether you're anemic or not. If you're not anemic, start taking food which will help build your iron levels, like a lot of spinach, eggs, red meat, or meat in general. Okay. If you're vegetarian, then you have to think as what kind of things you should be eating. A lot of leafy vegetables are helpful to combat anemia. And if you are still anemic, then you have to take iron tablets to supplement yourselves. Okay, so it is very, very important. So the most common cause, as I mentioned earlier, is nutrition, because we don't eat properly. Okay, we eat, most of the Asian foods is not healthy. They are tasty, definitely, but they are not healthy. So we have to make sure that we change our diet slightly and work towards what you call 5 a day. Okay, it doesn't mean that we double our diet and eat lots and lots and lots and become obese like me. No, you have to also maintain your health and maintain your lifestyle, maintain your height, weight, and your BMI, because that has, again, so much of problems. So the most common cause is malnutrition, then pure nutrition of the quality of food we eat, and sometimes it's because of malaria and hookworm disease, etc. But mainly is because of poor nutrients, what we eat. So that's about anemia. The other thing is what we'll talk about is when you are pregnant or trying to conceive, you have to have a certain normal BMI. Okay, it is important that you maintain your weight. The normal BMI is from 19 to 25, and if you're pregnant, it's a very common myth in Asian population that you have to start eating for two. Yes? No, you don't have to start eating for two. All you need is to have 300 calories extra. That's all you need to eat. 300 calories extra of good nutrient food, okay, throughout the pregnancy. So you won't gain lots and lots of weight. I've seen lots of girls who start with being a 50 kilogram weight when they are pregnant. By the end of the pregnancy, they are 80 kilos, which is not right, which is quite bad actually. So those are the things. Would anyone like to ask any question at this time? Then we can move forward. Rubina?
There was one question about the rubella vaccine.
Yeah.
Shabana asked if it's a lifetime vaccine, and I replied saying yes.
Yes, it is.
But if you could just clarify, no boosters are needed or anything, are they, for rubella? It's
No boosters, because rubella has a course. MMR vaccine has a course when you're born and in the childhood, and that should be enough. But sometimes, if they are not given properly and not at proper time, you may lose immunity, and it's good to get it checked. You can open the mute for every participant. If they want to ask something, they can ask questions at this moment of time.
Yeah, I will do that. We have a question from
Yeah.
Riha. I will unmute her if she wants to speak and ask. Just bear with me.
Yeah. Just unmute everyone so they can ask. It should be an interactive session now.
Yep. Okay. I will unmute everyone. Just bear with me a second.
Yeah. Because that makes life much more interesting.
Well, Assalamualaikum, this is Fariha. Firstly, Dr. Saleem, just want to say thank you. Session's really informative. It's really, this kind of knowledge I feel isn't always out and about for everyone. The question that I had was, you mentioned the rubella vaccine.
Yes.
If I'm honest, I don't remember what vaccines I've had as a child. That's something I'll have to check. But are there any other vaccines that you would recommend if you're trying to conceive, like, you know?
Well, for pregnancy, that's the most important thing. Okay. And also you should know your blood type as well, whether you are positive or negative. Means if you do the blood tests, you can be A positive, B positive, AO positive, AB positive, O positive. So you just have to check those whether you're RH positive or negative, because if you're negative, then you will need anti-D injections in pregnancy. So it's important to know your blood type as well.
In terms of vaccines, is that the only one then, Dr.
That's the only one.
Is that
Yes.
the main one?
Yeah, rubella. MMR is called rubella vaccine.
Okay.
It covers mumps, measles, and rubella. It comes in a combination.
Okay, thank you for that.
Thank you.
Does anyone else have any other question at this stage? If not, we can continue forward.
Okay. So regarding pregnancy, because there are a lot of what you call presentations, does anyone just ask the content, the participants, what they want to talk about? They want me to talk about more about pregnancy or more about menopause, or what? If you can ask them, because the awareness program is spread over 3 to 4 hours. So I'm just trying to condense, but I just want to know what sort of participants we have, so we can talk about whatever they want from me. You see?
Yeah. From the information that I have,
Yeah.
a few of the participants are actually trying to conceive right now, so it's been very useful up to now. A
Okay.
few of them are not interested in conceiving at all. And we have, someone just messaged Sabina Salam saying, can we talk about diabetes? And then I believe we have some menopausal
Okay, so what I will do, I will stop the presentation now at the moment, because I want to talk about most of the participants, and then we'll take it further. So if you're talking about diabetes, my dear, diabetes in Asian population is very, very high. The proportion of diabetes is, and especially in Asian women, diabetes, if you are pregnant, the thing called gestational diabetes, the incidence of gestational diabetes is extremely high. Okay. And what happens in diabetes, in Asian population especially, is, you're saying something, Rubina? Okay, in Asian population, what happens is, when we conceive, Okay, because most of the Asian population in the UK are immigrants from 50s and 60s, right? And they are very much used to of giving women a very high calorie diet. They have a special form of things which is made up of ghee and lot of nuts and almonds and this and that, and to give women that. So the calories are very, very high. And it was good source of nutrient for women in Pakistan because they were from the farming community and they didn't have the luxury to sit at home and have a maternity leave for a year or 6 months. They were all expected to go and back to work within a week at the most, back to work, back to the farming, and so on. So for those women, those high calorie things, which still are very much uh, prevalent in our society, because I see them every day in my clinic, that the girls start eating those because their mom or gran or nan has made that especially for them, and they say, no, you have to eat it. But those were for a different set of women where they really used to work very hard in the farms and they need a lot of energy and a lot of calories to carry on things. But those things are in our climate now, in our culture at this moment of time, it's not suitable because they are extremely high calories. And what it tends to do is that our culture and our society says that we don't burn as much calories. If we don't burn as much calories, then what happens is, especially Asian girls, they put on a lot of weight in pregnancy. And putting on a lot of weight, just imagine this, you're already at risk of getting diabetes as a population because of your ethnicity. Then putting a lot of weight in the pregnancy, you are double at risk of getting gestational diabetes, which means that diabetes at pregnancy. And diabetes at pregnancy, what happens is that it messes up whole of your environment and it affects the baby. If your diabetes is not well controlled, it affects the baby in such a way that baby's growth is restricted, or they just grow and get very, very big, which again is not good for the baby either, or to growth restriction or acceleration in the growth. So that is a problem. And diabetes is such a disease that it affects every part of the body, from the eyes to the heart to your circulation to your bones to the body, because it affects the eyes. It causes bone problems. A lot of people, you must have heard about diabetic foot. It's a multi-system disorder and causes malaise and weakness and everything. So it is very important that you control your diet. Make sure that you don't have too much of sugary things. Try to cut down your fizzy drinks. Try to cut down a lot of sugary food, like a lot of sweets and things. As long as you have a normal, healthy diet, then most of the time it's okay. But being Asian, we have to be extra cautious because we are at a higher risk of getting cardiovascular disease and diabetes. And especially if you're pregnant, the risk is even more. So in pregnancy, please tell your parents or nans that those things are good, but you have to maintain your diet and also maintain the weight gain, because with weight gain there is increased risk of cesarean section. Weight gain, there is increased risk that it will affect the baby, whether the baby can get very small or very large. With weight gain, there is increased risk of wound infection if you have any wound. With weight gain, there is risk of diabetes. And once pregnancy is over, then there is even higher risk that later on in the life, you will get diabetes. There is risk for the baby to be prone to diabetes later in the life. So in a nutshell, that's what diabetes does to you. Any other question?
Yeah, thank you for answering that. I hope that answers the question, Sabina. So I think the takeaways from that are to reduce sugar intake and maintain a healthy weight. Is that accurate, Dr. Saleem?
Exactly. And as I said, that being pregnant, you only need 300 calories per day extra food, not 3,000 calories.
Okay. We have another question from Shabana. She's asked, how long does menopause last? And are there any natural cures rather than HRT, so hormone replacement therapy? how long it lasts, and
Yeah,
any natural
so
cures.
there are few stages for menopause. One is called premenopausal, where it can start. It's very varied, and it can start from 40 years of age and goes on until you have stopped your cycles. Premenopausal stage is where your body is, the hormone levels are going up and down, and as a result of that, you have different symptoms. The main symptoms are hot flushes. You all of a sudden you start feeling hot. In the night time, you have night sweats that you wake up and the whole sheet is wet, or there are patches, and you're worried what is happening. And the third thing is mood swings. Most of the women denies mood swing, but if you ask their husbands or partners, they acknowledge that yes, mood swings is one of the quite a tricky thing. Again, it is to be aware of your own body, because most of the people I talk to and the parents, the children of those parents, they say, "Oh, I don't know what's wrong with my mom. She's just up and down. Like I can't talk to her." And she says that uh, there is a particular sentence in Urdu. They say, "Aag nikal rahi hai laakh paon se." So we don't understand how fire can come out from the legs or foot or feet or whatever. So there are a few typical sentences which they use it. So it's not their fault. It's not the fault of your mothers or grands. It is the hormonal imbalance which is happening in the body, and that's what it's a natural phenomena. So please do talk to your moms, and if you are suffering, if you are in that age bracket, then that is because of your hormones, and that is known as pre-menopausal. So hot flushes, night sweats, and mood swings. These are the three main symptoms. Normally, 10 years ago, people used to give them HRT. Then there was a research which shows that HRT increased the risk of breast cancer, but only very slightly. If you talk to women who are in their 70s, they have been using HRT for 15, 20 years. But the new concept is that you can use HRT. HRT is hormone replacement therapy, but you can use it for 2 to 3 years. Personally, if someone is suffering too much with HRT, I would give HRT for 2 to 3 years. That's the max I will give the HRT for. But there are a lot of different things which can be used. But again, we can only suggest, but we don't recommend, because there is no evidence base as such. Like primrose oil is one of the things. In Holland and Barrett, if you go, there are a lot of medicines there for pre-menopausal women or perimenopausal women. And menopause, what the main effect of menopause is that it makes your bones brittle, because estrogen, the main hormone in women's body, helps to maintain the bone density. And once you go through menopause, the estrogen levels comes down, and your bones get brittle and brittle. The resorption of bones start taking place, and most of the women can suffer from a thing called osteoporosis, where it is a brittle bone disease. And if you look around in our society, the women who are then in their late 60s or 70s, there's quite a significant number of women who would have a fall in the bathroom and things, and the thigh bone get fractured, and it's very difficult for them to heal, and later on they die because of the morbidity associated with the fracture, because fracture causes them to be immobile, and immobility causes them to develop clots, and that's a major cause of mortality in Asian women, in older Asian women, because of fall they have fractures and things. So the best simple thing again is to be healthy. Yeah, in our Asian population, that's I do these courses regular basis, and when I'm talking to specific women who are menopausal, I said you should exercise, and in their mind they think that exercise is wearing lycra and spandex and things, and then only they can do exercise. But that's not the case. Exercise you can do it at home. You don't have to really go to gym and wear those fancy things, because that's the mindset of our Asian population, that they think that exercise it's something alien to them, and it is partially our fault. Like we are the generation when your mom wants to do exercise and things, we don't encourage them. I say, "Oh, mom, you to budi ho gayi, bas namaz padho and something." But that is wrong. You see, 50 plus is not budi. This is middle age. Okay, If you tell that 50 that you are old to a Caucasian lady, she will be very much unhappy with that. Try it and see what happens. So exercising is very simple. What you need to do is, if you can't walk and things too much, you have steps at home. Hold, just take one step at a time, and with the leg you go up, and with the same leg you come down, and start with your left, and then start with your right. 10 times it to start with. Make sure that you hold the rails because you don't want to trip. That will help your muscles. And so start with 10, first set of 10, then increase to 20, and then from once a day to twice a day to 3 times a day. So that will help your bones in your long bones in your body. Then you can do a lot of isometric exercises where you are in a stationary position. Sit straight, put your hands together like this. I don't know whether you can see me or not. And just inhale and just push your hands against each other. So you are using your own force against each other, and just exhale. Hold it for 15 seconds and then inhale and exhale. Do the sets for at least 5 sets at one time and start increasing it. So these are small tips for that. And if you want to know more, you can email me or WhatsApp me or go to our Facebook page, and then we will give you all the different details how you can have a healthy life after menopause. I hope that answers the question. Any more questions? Rubina?
I don't see any more unless anyone has any. To the new participants, two of you who have just joined, we're halfway through the program and we were just taking a pause for any questions. So if you have any questions at all to do with women's health, feel free to ask, and Dr. Saleem will do his best to answer. Just that section, or just unmute yourself and let us know. If not, we'll continue.
Okay, so if we go on with the pregnancy, so pregnancy, if you're pregnant, again, I'll recap. Get yourself rubella, check whether you're immune or not. Make sure that your blood, get checked for anemia, whether you're anemic or not. If not, have a healthy lifestyle, healthy diet, 5 a day. And once you conceive, then you have to make sure that you eat healthy diet and try to break your meals into 5 small diets, because hyperemesis, the morning sickness and things, is very, very common when you feel nauseated. And it starts from 6 weeks, goes up to 14 weeks. And it is a very terrible situation for a woman who is pregnant. So the best way to combat it is, instead of having 3 full meals or 1 big meal, you break your meals into small diets. So in the morning, you take a slice of bread, or if you're taking cereals, just half a portion of cereal. At 11 o'clock, again, take some fruit or a biscuit or something. Then at 1, take small lunch. 4 or 5 o'clock, take a fruit. 6 or 7 o'clock, take something light. What it does is that mainly the nausea you're getting is for the acid buildup in your stomach, and that gives you a very bad taste. So if you start eating regularly in small bites throughout the day, you trick the stomach into working harder and harder. So all your acid component is being used. If it is used properly, then you will feel less nausea and vomiting. And make sure that you drink at least 3 liters per day. And that is for everyone. In normal day-to-day life too, we should drink at least 3 liters of water. But the way to drink it is you sip away throughout the day so that the water is absorbed properly in your body. Okay? Because if you start drinking and you drink a whole glass of water, then you will be running to the loo. And you take in and it goes out. It doesn't work like that. So the best thing is to drink water, sip by sip, throughout the day, so it absorbs better. Because our body is 70% water. Yeah? So break your meals into 5 or 6 portions when you're pregnant. Even in normal diet, it's always best to have small portions rather than big portions. So it maintains your blood sugar throughout the day in a nice way. And drink 3 liters of water. So that's the pregnancy in the first half. And to be honest, pregnancy is not a disease. Okay? In Asian population, it's taken up something abnormal, something unusual. It's not. It's a very normal thing, and you should behave normally. You should keep on working. You should keep on doing things because you should be active. Because pregnancy also causes one other problem is that the risk of clot formation increases 60 times. Okay, so in not so much in England, but more so in Pakistan, when you're pregnant, it's a myth that, oh, don't walk, don't talk, don't do this, don't do that. And the girl is just sitting on the couch doing nothing and getting fat, which is wrong because if you don't walk around and if you don't mobilize yourself, there is increased risk of getting clot formation. And in pregnancy, if you do the same, it's even higher. So you have to treat pregnancy as a normal thing and just go about working normally. And that's about it, basically. So that's the first trimester, 12 weeks. And then normally we'll see the patient at around 10 to 12 weeks have a scan, which is known as a booking scan. And then later on, if everything is normal, you will have a 20-week scan, which is known as anomaly scan, where we check the whole system of the body, making sure the baby is normal. If there's any concern, then you will be referred to a tertiary center. And then if everything is normal, normally I will send the patient back to the midwives to look after the patient, and then you go and deliver. It's as simple as that. And about 4 years ago, there was a trend that cesarean section was the flavor of the month. Basically, everyone wants a cesarean section. But that is not right because you cannot compare cesarean section with a normal delivery. Pregnancy is a normal phenomena, and we should try to go for normal delivery because A, it's natural, B is the safest mode of delivery because that's how God intended women to be. Once you deliver, you go back to your normal day-to-day life early, within 24 to 48 hours. There is a lot of bonding between the newborn and yourself, and that bonding is very important. Then there is early initiation of breastfeeding. Again, breastfeeding is the most important thing for the newborn. Then if you're up and about, there is less chance of infection. There is less chance of bleeding. So there are a lot of advantages of normal delivery. So I normally don't do cesarean sections for maternal request because I think it is not the right way forward, because every woman should be able to deliver and have a nice normal delivery until proven otherwise. Yes, not 100% women can deliver vaginally. There are incidents where you have to have a cesarean section. There are different reasons for it. Maybe the afterbirth is low lying. Maybe you have some problem, back problem or spine problem, or there is any other medical problem. But by and large, women can go and have a nice normal delivery. So much so that I've started a dedicated VBAC clinic, which is known as vaginal birth after section, where we try to counsel the patients and encourage them to have a normal delivery after cesarean section. Okay. So take home message is normal delivery is the way forward, but if there are complications or there are reasons, then the next best thing is to have a cesarean section. Cesarean section has its own advantage as well, which are it's planned. So if there is a reason that you need a cesarean section, the elective section means that it is all planned. You pick a date and you come and have a section, go home. It does prevent any degree of tear down below, and it is protective for any tears down below, and hence it is protective for prolapse in later stages of the woman's life. And naturally, you won't go through the labor pains because you will have pain relief like spinal or epidural analgesia. But it has disadvantages as well because, first of all, it's an operation. You all should realize that any operation carries risk of infection or bleeding. So it is an operation, though it's easier for us, but it is an operation. We have to cut through all the layers to get to the womb and then deliver the baby. So there is risk of infection, there is risk of bleeding, yeah, and there is the initial bonding which happens at the normal delivery doesn't happen because you are in pain, yeah, because naturally you had an operation. There is also risk of damage to the bladder and bowel. There is increased risk of bleeding. There is increased risk of clot formation. Hence, after cesarean section, we give clot thinning injections for 5 to 10 days. So all these things are the disadvantage of cesarean sections. And there is also, it takes about 6 weeks for you to recover. So the initial bonding, it takes time because it's difficult for you to walk around and things. But we are coming with a program. A lot of hospitals are encouraging people to be delivered, have a cesarean section, and go home within 24 hours of having cesarean section. So that's a new way forward. But yes, it is an operation and it carries its own risk. Okay, so we are talking about a bit about obesity now, which I've talked about. You see the chart. I hope you all can see the screen. So the best thing is to be healthy, which is the green thing. It's not easy though. It's hard work because we are not used to it and we don't think that way. I am somewhere between here. My BMI is 25.3, I think. So I'm still not healthy weight. I'm still in overweight capacity area. And then there is obesity where the BMI is more than 30. So if you see being underweight, which is here somewhere, is not healthy as well. Being overweight is not healthy. So you have to be in the middle. So it is very important that we start looking out for ourselves from today rather than from tomorrow, because tomorrow never comes. As we all know that we all make New Year's resolution and only 10 or 15% stick to it. By the end of January, it's all gone. So if you want to do something, start today. So this is again going back to weight gain in pregnancy. If your BMI I mentioned about is 19 to 20, 25 normal weight, 25, 30 is overweight, over 30 is obese, and more than 40 is severely obese. So as I mentioned earlier, that it's a myth that you should eat for 2 and you should go on having more weight put on in pregnancy. So if you're a normal weight, it's about 35 pounds weight gain is acceptable, which is about 2 stones roughly, just under 2 stones. If your BMI is, if you're underweight, then about 2 stones. If you are between 25 to 29, which where I comes in, or slightly heavier weight, then it's under between 1 and 2 stones, about 1.5 stones. And if you're quite obese, the 30 plus, then just above 1 stone weight you can gain. But that's about it. You have to be careful that you don't put on too much weight, and you have to measure your weight on regular basis, because if you gain too much weight, then it's the root cause of all the problems in pregnancy. So I mentioned this about that you all should have a healthy diet, and you shouldn't eat for 2. You only need 300 calories extra per day. So don't, and this is all evidence-based. I'm not saying these things from out of their thin air. It is all evidence-based in research material. In pregnancy, again, as I mentioned earlier, that if you gain weight, then what will happen? That there is increased risk of cesarean section, increased risk of gestational diabetes, increased risk of preeclampsia. Preeclampsia is the condition where your blood pressure goes high and you have fits. In UK, we have a very robust procedure where we can who goes and have fits. But in Pakistan, it's very prevalent, and preeclampsia is very, very, very high, because again, there is not a screening method. There are not services where they can pick up high-risk patients and treat them timely, and the women fit before, during, and after pregnancy, and it is quite dangerous for the mother and baby both. Okay, now we're talking about breastfeeding. Again, breastfeeding is slightly on the decline nowadays because most of the mothers are professional women, and they think that bottle-fed babies are better and things. But you see, I am very much, I'm a doctor, but I'm very much towards natural things and natural phenomena. Breast milk is suited best for the babies. That's how nature intended it to be. The difference between breast milk, mother's milk, and cow's milk is huge because in cow's milk, that calf needs to get up and walk. So the nutrient value is more to develop physical needs. Hence the composition is different. In humans, the needs are more to develop mentally and more inner development rather than physical development. So the nutrients are different. Breast milk is designed by nature for the newborns. So you cannot complement it with any other thing, or you will compete with any other formula milks. There is a myth in Asian culture that, the first milk, which is clear, which is called colostrum, is a bad milk and you shouldn't be giving it to them and things like that. But it is totally, utterly wrong. That is the most important feed for the baby because it contains a lot of immunity. Okay, it is preventive against all the allergies, antibodies, and things. It is the most important thing a baby should have. Colostrum also have laxatives in it, and it aids in digestion. It aids. So the babies who have breast milk, they have less tummy problems. They have less aches and cramps. So, as I mentioned, colostrum is rich in immunoglobulins, and it provides a protection against any infections, against hay fever, against all the immune reactions and allergies. So, it is important for the baby that we feed them colostrum. Similarly, there is a thing called immunoglobulin A, which provides a lining in the gut and everywhere to protect the baby. So, there's another thing called beta carotene, which is the antioxidant. So you see, nature is very kind and it provides us with all the things to combat. But if we disregard that and go on formula fed, I think we are not doing justice to the babies. And there is a comparative study which shows that babies who are fed on artificial feed, they are more likely to have tummy problems, 5 times more likely to have tummy problems. They are increased risk of having diabetes. They have increased risk of having water problems. So do you really want your children to suffer all these things just because you don't want to breastfeed? I think not. Okay, so yes, breastfeeding is difficult. It's not easy. I don't say that it's easy. But if you do that, you will help your child to be a healthier individual in the long run.
We have a question.
Yeah.
If you don't mind. Shabana asked, I've always been told by elders to be careful of what a new mum should eat when they're breastfeeding, as whatever the mother eats, the baby receives. Is this true?
It's partially true because, again, you shouldn't be having too much of what you call spicy food and things because naturally, whatever you eat, it is replicated in the breast milk as well. And that's the reason if you see some of the medicines are excreted in breast milk, like metronidazole, which is known as flagyl, it gives a metallic taste to the baby and then baby goes off the milk. So yes, you have to be careful that you don't eat very spicy food. And if you see that if you are going on a healthy journey, healthy lifestyle, then a very high spicy or very high in what you call masala and things is not recommended anyway. So the best to keep it simple, and naturally, yes, it helps. So yes, depends what you eat while breastfeeding. Any other question?
Just bear with me a second. Yeah.
Yeah.
Let me just unmute Sultan. I think he wants to
Yeah.
ask. Just bear with me a second, Sultan. I'll just unmute you.
Yeah,
Yeah.
she's. Hello.
Yeah, Dr. Saleem Khan. This is Dr. Sultan Khan. I'm a consultant gynecologist in Saudi Arabia.
Hi. How are you?
How are you? I just want to comment on your rate of, I mean, you mentioned about the cesarean section, you know, particularly by the mothers and this thing. I'm sorry to tell you, in Pakistan, probably the cesarean rate is more than 85% because we, the gynecologists, we just force the patients to go into cesarean section, number one. And actually, honestly, we don't actually communicate with them, and the practice, because there is no accountability. So most of the gynecologists, they would advise their patients, but you know, to just go ahead for the cesarean, because they would tell them different stories that there is a, you know, asphyxia or something, or, you know, oxygen is not reaching the baby, number one. Regarding anemia, actually, there are a lot of glomerulonephropathies in Pakistan as well, which unfortunately we are not investigating, you know, and I mean, I'll come back to the previous cesarean. We have a lot of patients here in Saudi Arabia. In my department, I mean, I have a standard policy, and 80 to 85%, rather 90% of the patients with previous cesarean, they deliver normally, actually. And as you mentioned, I really appreciate it. I don't do any cesarean on maternal request, you know, until there is an obstetrical reason for it, or there is some other this thing. Otherwise, I usually don't do it. You know, even I tell the patient, you can change your consultant, and this is actually, I mean, the policy in our department, actually. Thank you very much. The lecture was really, you know, informative, and it's pretty good. I really appreciate your efforts.
Sultan Bhai, thank you very much. That is what we are trying to do in IFMCH. I don't know whether you have heard or not, because we are a charity and we provide free services. We don't believe in taking money and providing service. So
Saleem Khan, one thing, please.
Yes.
I think I wrote to you people as well. I mean, I don't know where your hospital in Pakistan is.
The hospital is being constructed as we speak, Sultan Bhai, but you know, in Pakistan, to carry out anything, it's a major task.
Oh, yeah.
So our pillars are up. And our pockets are dry. So we are trying to continue, and inshallah, and I think.
No, that's I mean, I'll be too glad to at least, you know, give some money as well, you know, honestly speaking. And I would like to work as a volunteer, even if you have your OPDs. I'll be going for 2 months vacation in September. So I can just attend your OPDs at least for a month, if not longer, you know, because 1 month I would like to spend with my family. I mean,
Sultan Bhai, thank you very much. If you can just text my secretary Rubina with your details, yes. Or you can WhatsApp me. And in fact, everyone can use my number. My number is a UK number. It's 4477.
One second, Saleem Khan. I'll just write it down.
I will write it down for everyone in the chat, so you don't have to write it down.
All right. Okay. Excellent. Thank you very much.
You're welcome.
We'll put our email as well. So do get in touch with us, Dr. Sultan, and if you can leave your email as well and your number in the chat, that would be really helpful.
I'm going to leave it here. Yeah, and Saleem, I'll be too glad to donate something. Actually, you know, you know,
you're very kind.
Yeah, you know,
yeah,
at least I'll donate at least 1 million rupees now, and then, you know, I hope I can get your account and everything. You know, I'll send it to you. Okay.
Thank you so much, Sultan. I think we who are abroad and who have graduated from Pakistan, we feel for the women there in Pakistan. Unfortunately, the culture in Pakistan is that it is very much commercialized, you see. And I have always worked in the UK, and here we have NHS, and all our practice is quite ethical because we are not paid from the patient. So we have a standard salary, and whether we do one section or 10 section, it doesn't really matter. But that's the reason our practice is very, very much ethical. Wherever there is money which change hands, it causes problems. Same is the case with America or Pakistan or India.
Yeah.
So
actually, Saleem Khan, actually, I'm senior to you. I'm much older than you. Honestly speaking, when I was a student and even I was a senior registrar and assistant professor in Khyber, things were not the way it is today, unfortunately, you know. It's really, unfortunately, we have forgotten Allah, we have lost all the ethics, we have lost all the morals, we have lost all the medical ethics, I would say, you know. And something I don't want to mention here, actually, even my daughter was scissored 3 years back in Islamabad by one very famous gynecologist, and you know, I had to really fight with him.
I think we all like-minded people should work together, use this platform, and do whatever we can. We may not be able to bring major changes, but even if we can save one life, I think that's life worth saving for. So
I'm here with you. I really appreciate. I've been reading about this organization, and I really appreciate it. And I've been writing, in fact, you know, and I can assure you, you know, I think I'll be leaving in a year or two over here. I'll go back to Pakistan. So I'll be very, very glad to do anything possible from my side there. So
thank you so much. Probably what we'll do is I'll give you a call later on today sometime, and then we can have a detailed discussion.
Excellent, excellent,
Thank
excellent.
you so much. Thank you very much.
Thank you so much. Thank you.
Okay. So that was Dr. Sultan from Saudi Arabia, and I'm very glad that people are joining in and listening. We'll be posting this in our Facebook page as well. So the whole idea of our awareness program is to change basic principles, and it's not rocket science. Everyone can do it, and I hope that there are 9 or 10 or 12 participants today, and I hope that they will start changing the way they look at things, and they will change the way they see things and make a difference in their lives. And please do remember us in your prayers. I think we will. Do we have time, or we are finishing, Rubina? Because I can go on for hours and hours.
We know you can.
Yeah.
I mean, I did book us in for an hour and 15 minutes or an hour and a half. So we could do another 10 minutes, but it's up to the participants.
Yeah.
If anyone has any more questions, now is your chance. You know, Dr. Saleem, and obviously we have Dr. Sultan here as well, both consultant obstetricians and gynecologists. So do take this opportunity to ask any question that you have.
And also just post my WhatsApp number in the chat thing, and they can ask me. Yep. As most of you know that my phone is 24/7 on, and rather than ringing, just WhatsApp me, and I will try to answer the questions as much to my best of my abilities as and when possible, because I strongly believe that Allah has given us, if I'm a doctor, not because of me, because of the opportunities Allah has given me, and it is my responsibility to give things, to give it back to the community or whoever I can help. So do not hesitate. You can send questions on my WhatsApp any time of the day, and I'll try to reply as soon as possible. Any other questions at all? Shabana, do you want to ask anything? Unmute Shabana, Rubina, and see if she wants to ask anything.
She is unmuted.
Yeah. Shabana, do you want to ask? Hi. Thank you for joining in.
No, you're very welcome, and it's been an excellent session, very informative. Massive thank you to Dr. Sultan as well, very, very generous, alhamdulillah. I think I've basically asked the questions that I needed to ask. Yeah. I think one does come to mind, maybe it's because of my background working with hepatitis, that if someone discovers that they are hepatitis C positive,
Yeah.
what kind of care should they sort of, how would they look after themselves, or what care should they take during pregnancy?
Basically, we don't tend to do anything much with them, but all they need to, first of all, we need to know when they got the hepatitis and how they got infected and what is their current situation is. And in UK, what we do is we have specialized units for them, specialized clinics for them, and they are referred to those clinics. But by and large, we just monitor their disease status as what's happening. And then we do regular scans for people who have any medical condition to make sure that the baby are growing well. But nothing much, to be honest, as far as I can recall.
Right. Okay. Yeah.
Only at the
And what
time.
about the care in what about the care in
Only at the
Pakistan
time-
then?
Dr. Sultan wants to say something.
Yeah, please. Only at the time of delivery, actually, I mean, the delivery room which we use is, it has to be, sterilized, I mean, at once. That's the only thing, actually, The rest, as already explained by Dr. Saleem,
Yeah.
I mean, we don't do much for them, but only for the delivery. We have to just, the equipment we are using it, or, the room we are using it, it should be sterilized soon after has delivered.
Yeah,
Actually.
it's a standard practice here in UK that it's done proper cleaning after every procedure.
Yeah.
So that's is a standard. And now with COVID, it's extremely that we clean and keep the theater for 20 minutes to dry and things. So it's with COVID, things are still very, very stringent now.
Yeah. Yeah. We have a separate theater for that. Actually, I did a cesarean on one patient with previous 4 cesarean last week, actually, with COVID positive. Alhamdulillah, is okay. We discharged her. He's fine now.
Yeah. Okay.
Very trying times.
Okay. Thank you very much for all. I think we should conclude now. And Rubina, if you want to just close the meeting with your remarks, and then we'll see. As we'll keep you all posted, because we want to do these programs on a regular basis and try to empower and educate our women so that they can take the right health choices. If I believe that strong, healthy mothers will make a difference for the future generation, and hopefully there will be some difference in our community later on.
Thank you very much.
Thank you so
Thank
much.
you.
Yeah, if you don't already, please do check out our website and our social media pages. And yeah, keep in touch with everyone. And thank you so much for taking time out of your precious Sunday to listen to this. Not many people would, so it's really great that you're prioritizing wanting to look after your health.
Oh, and one more thing, Rubina, can we ask for the feedback, please? Because we are here to improve on as we go on. Yes, that would be very, very helpful.
Yeah.
If you can just send your remarks and how we can improve further. We are still not very savvy with our communication things, but we are getting there slowly but surely.
Yeah, I've just made another
Rubina,
note.
can I just suggest something? Sorry. Can I
Yeah.
just suggest something? When we're doing the webinar, is it possible to link it in with Facebook as well? So you're doing it across the
yes, we
live.
tried, Shabana, we tried today, but somehow I think it has to be paid in and things like that. So probably we have to pay in to have a Zoom account to link it with Facebook. This is our free account, so with that I think we cannot do it.
No,
so
no,
we are looking into that.
This is the organization's account. It's the business account. So I'm not sure. We just weren't able to get it to work, basically. But yeah, I couldn't see the option, but Dr. Saleem could. But we're recording this meeting, so we'll put it on Facebook Live. But yeah, that's a really good suggestion for next time. I'll try to make it work. Yeah.
Okay, that's fine. Thank you.
But we are still struggling with all the new technology, and I'm too old to retrain, Shabana. I'm trying, but yes, we'll get there.
No, you've got plenty of good years ahead of you. Don't worry.
I'm sending you our website, Dr. Sultan. You can take a look.
Yeah. So, Dr. Saleem Khan, then I'm ancient, you know, if you call yourself.
I believe you're only as old as you think you are.
Yeah, that's correct. Yeah. But actually, we have all this IT technology, Zoom, and everything. We are doing it almost daily. And
Yeah.
because of COVID, we are not meeting. Actually, we are just meeting through the Zoom.
Yes.
And all the committees, morbidity, mortality, and all those cases, actually, we are discussing it, you know, and then patient risk and safety, I'm a chairman of this committee and morbidity and mortality committee. And I'm thankful to Allah subhanahu wa ta'ala that in the last 13 years, I'm heading the department. I did not have single mortality here in our hospital, you know, King Saud Hospital in Al Qasim area. So anyway, I requested Rubina to send me the site. I would like to pay you the money through my credit card if I can, please.
I've sent it in the chat.
Yeah, Rubina, send the UK account details.
Yeah, exactly, the UK account. Yeah, that will be easy for me.
Yes.
That will be easy for me.
Yeah.
Yeah. So
you're very kind, Sultan Khan, and hopefully together we can make a difference.
Inshallah. I told you I'm always there at your, you know, service. Whatever you I really appreciate your efforts. I must tell you, really.
Thank you very much. And if you happen to come to UK, please be our guest. And
where are you based, Saleem Khan? Where are you based?
I am in Manchester, but I can be anywhere.
Okay, no, because I have to come to, you know, Bangor. One of my very close friend, Dr. Zaid Farouk, he's a lead gynecologist there, and you know, probably, yeah. So
Bangor is not far from where I am. So if you are planning, do let me know, and then inshallah we'll.
Yeah, he usually comes to Manchester to pick me anyway. But anyway, I'll definitely make it a point. Even if I go to London, I'll come over. I'll definitely come to meet you, inshallah. I'll come to meet you.
Of course. Thank you so much.
So much. God bless you, dear. Thank you.
Thank you.
Thank you, everybody. And I'm really congratulate you for all the good job you are doing. Really,
we will do it together. Sultan, we'll do it together, inshallah.
Thank you very much. Thank you.
Allah Hafiz.
Allah Hafiz.
Okay, Allah Hafiz.
Yeah, I'll end the session now. Thank you so much again. If you guys could leave any feedback via email or even on our Facebook, that would be really appreciated. Thanks once again, and enjoy the rest of your days, and take care.
Thank you. Bye.
Thank you, Rubina.
Thank you
Thanks.
so much.
Bye. Allah Hafiz.
Allah Hafiz.
Thank you. Bye.
Bye.